So let's discuss some different imaging, what it's used for. So after a trauma, you may go to the hospital, to an imaging center, to a medical doctor, to a chiropractor. There's 4 main types of imaging that they look at, and each one has a different use. So first is X-ray. X-ray is used to look at primarily, is there a fracture or a dislocation? So it's used to see, is there a problem with the bone? Is there potentially major alignment problem? And also on X-ray, you can also see soft tissue to a certain extent. You can see masses and things that would then say, oh, we should probably dive deeper with another type of imaging. Okay, so that's X-ray. Then there's CT scan. So CT scan, much higher radiation than X-ray, like 17 times higher in some cases, so a lot of radiation. They can do more specialized imaging and they can get more angles to see bone to also look more in depth for fracture that maybe you can't see on a plain film X-ray. So that's where CT comes into play, especially when there's stuff going on with the head, the neck, the skull. CT can be really useful. Third one is MRI. MRI is not radiation. MRI is using a magnet and it's looking solely at soft tissue. The purpose of MRI is to see if there is edema, there's swelling, there's various types of tears. Certain tissues can be visualized. They look at the disc quite a bit in the spine, like that's something you hear about all the time is, do I have a disc herniation? I did an MRI, it showed me if I did or I didn't. The last type of imaging was something called digital motion X-ray, which is a motion study, which is the gold standard for looking at instability and ligament injury. We have people move because our bodies are dynamic and a lot of these injuries hurt when you're moving, right? Not necessarily when you're just holding still. So we want to actually take people through movement with digital motion X-ray. We move them and then we can freeze frame out of 20 shots per second, because it has 20 captures per second. We can find that exact frame that shows us where that injury is. We can visualize things like facet gapping and facets overlapping. So 4 types of imaging, again, X-ray, CT, MRI, and then a motion study. That's the main stuff out there. When someone does go into the ER and they get X-rays, and let's say they brace them in their neck, so like let's say they're transported by ambulance, they put a cervical collar on, they don't move them, they say let's get an X-ray and make sure nothing's wrong before we move them. They go and do an X-ray, they clear them, they say they're fine, they give them painkillers and muscle relaxers and send them on their way home. That's what happens like 99% of the time. They might tell them, follow up with your primary care doctor. And then the person's like, I'm feeling a little bit better a week later, I'm not gonna do anything. That's not the standard of care, because if that person was in a lot of pain at that moment and their muscles were spasmed and splint and they were tight and it was a brand new injury, one is they may not be able to see the fracture at that time because the fracture will develop once edema and swelling infiltrates in between the fracture line and creates separation in the bone. That can take several days up to a week. What they should do at the ER is they should tell them in a week or 2, you need to come back or you need to see this type of specialist and get this checked out. And most people, because they're not told to do that, they don't do that, and then they never fully dive into potentially finding this injury that's gonna affect them for the rest of their life.
Right.
It's looking at patient findings, it's looking at multiple types of imaging, but it's also doing a good physical exam and seeing, is there a problem with neurological responses that follow certain nerves that connect to certain levels of spinal issue that you can see on imaging? So it's putting that whole picture together. You can't just put up an image and say, aha, there's your problem. You have to actually know how to examine and evaluate the patient and interpret all the findings. And that's a thing that unfortunately is just lost in healthcare, because healthcare, they want to make it very cookie cutter.
And time. If you're using health insurance, your health insurance provider has allotted your healthcare provider 15 minutes for an exam.
Video presentation by Meridian, Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic, and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian, Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.